Okay, we are live. All righty.
Okay.
Just got to give it a few. It has a little bit of a delay. I feel like I don't move. I'm trying to show your book.
Thank you. I can't see it, but thank you.
Oh yeah, I have it right on the backboard.
Uh,
Hi everyone, welcome. We want to give you all a second to join in. We have an exciting interview today with Dr. Burke, and we're going to learn a little bit of history, but we're going to learn a lot more about the future and what it is that Dr. Burke and her team and her colleagues are doing, and what you can do to help out on today's important topic. So, yes, there we go. There we go. Dr. Linda Burke. Okay, so I have known Dr. Burke for a very long time. It's a little bit over 10 years. She is a friend and a brilliant physician, board certified physician. She's also an author of the book that I have, book that I have behind me called The Smart Mother's Guide to a Healthy Pregnancy. And I'm just going to give you a moment to introduce yourself and let everyone know who you are and the amazing things that you do. Welcome, everyone.
Thank you. Wow, that is a very gracious introduction. I thank you so much. I'm very humbled. And it's been wonderful seeing you again, because we worked together for a long time, 10 years ago. So good afternoon, everyone. I'm Dr. Linda Burke, board certified OBGYN physician, blogger, and author of The Smart Mother's Guide to a Better Pregnancy. I am also very active in the reduction of medical errors as it relates to pregnant women and, of course, Black women. I want to talk today about historical GYN events that people may not know about. I did not know this history, and I've been a gynecologist, for over 3 decades. So I am also a member of the American College of Obstetrician Gynecologists, also known as ACOG, and there are a number of African-American OBGYN physicians who belong to a group called MOCA OB. And so in light of the maternal mortality disparity as it relates to African-American women, we've been very sensitized to issues that adversely affect Black women. So as a OBGYN resident, we use an instrument called a speculum. And any woman who has had a GYN exam has probably experienced the use of a speculum. And basically, it's a tool to better visualize the internal anatomy of women. So there is
a very fun tool.
Right. It does take a skill set because it could, potentially be painful. And so this leads me up to talk about the origin of this Sims speculum, which takes me to a gentleman named James Marion Sims, who was the founder of the speculum. But here's the tragedy of his history. He's been lauded the father of gynecology. There was a statue commemorating him in Central Park. But if you go back to his history, he was born in South Carolina during the antebellum period. And during his training as a physician, he was a surgeon. And he didn't really like surgery in terms of women, but he realized that in order to be effective, he would have to visualize the internal anatomy of a woman. And so what he did was he used his female slaves, Betsy, Lucy, and Anarcha, to refine this tool that eventually became the Sims speculum. And also he created this procedure called the vesicovaginal fistula repair. And basically, that's a big term. And when when you are in labor, and if you are laboring long, there's a tremendous possibility that you could damage your internal organs. And so
Right.
this fistula it's like a connection between, it's a hole. Basically, that's what a fistula means. It's a hole. And there's this connection between the bladder and the vagina. And so unrepaired, you have urinary incontinence. So he used these poor women, Betsy, Lucy, and Anarcha, to practice. And his methodology was no anesthesia. And he would, cut the tissue to practice. And of course, you can imagine, I can't imagine how horrific that was.
Right.
And this went on for a very, very long time. Now, the controversy is that he, like I said, he was lauded because after he refined his this technique in terms of the fistula repair, he went on to Europe and he performed the procedure on Caucasian European women with anesthesia.
Right.
But he had learned this technique on enslaved Black women.
Without.
So as the truth started to emerge, his reputation became challenged. It started in the 70s.
As it should have been. Yeah.
Right. So somebody wrote a book criticizing his techniques, and he was defended vehemently by our OBGYN colleagues, and their rationale was there was no anesthesia in the 1840s. People have benefited from this procedure, including African women, et cetera, et cetera. And the Medical University of South Carolina endowed a chair of $750,000 endowment in his name. Well, as we move on into the 20th century, 21st century, the controversy heightened. And there were 4 Black women who stood in front of his statue in Central Park. He had this big statue, and they wore hospital gowns with red paint splattered in the area where the genitalia would be. And it was a visual protest, and it was very effective. And as of 2018, de Blasio removed the statue. Ironically, this guy was, Sims was born in South Carolina, but he made his way to New York.
Yeah. Wow.
And then he became the president of the American Medical Association, blah, blah, yada, yada, yada.
So he was a pretty big deal.
Right. So they removed the statue. They didn't destroy it, but they transplanted it to his burial site, which is in, of all places, Brooklyn, New York.
Wow. Okay.
So
I didn't know that.
Yeah. So the African American female OBs petitioned ACOG to commemorate Anarcha, Lucy, and Betsy for their contribution to the development to the enhancement of the specialty of gynecology. So
yeah, they're forced. So it's forced. They didn't really contribute. I'm sure it wasn't, hey, try
right.
the body out, right? They were forced. They were slaves. So
exactly. Go ahead. I'm sorry.
No. Finish your thought. What I want to do is take a moment, backtrack a little bit for some people who don't know the history. But yes, finish your last thought, and I do want to just backtrack just a bit.
Yeah, no. So the irony is that everybody knows who Sims is, but no one knows who Lucy, Betsy, and Anarcha are, and we feel that they are just as important as even more important than sins, and they definitely need to be recognized and incorporated into the history of gynecology. So that's what the petition is about.
And I don't know if it's gone this far, if they know any descendants of, if they're thinking about compensation, right? And that's where I wanted to backtrack to a little bit to speak about. And in this story, I know at this point many people know about the story of Henrietta Lacks, right?
Yes.
And what has happened to her. But for those who don't, can you take us a little bit in history to talk about that and her contributions and what happened to her and the controversy around financially compensating the family for everything that she has done, which is pretty much, it's what you're talking about now. And these are stories that we know. Think about the probably thousands of Black women and Black enslaved women who were, used. They're, even I will go there later, but even with Black women dying in childbirth now, every time I see that, I'm texting you and I'm just like, did you see, like, this is insane. It's 2020 and Black women are dying in Brooklyn, New York, giving birth, trying to give birth at 8 months is ridiculous. And I feel that it all,
oh no, there's a continuum. There's definitely a continuum. And I want to say, before we talk about Mrs. Lacks, I want to say that what Sins did still goes on today. And when you and I talked about Sins, it brought me back to when I was an intern in 1987 at Brookdale Hospital in Brooklyn, New York. And my colleagues, the senior colleagues, third and fourth year residents, I was a lowly intern, they would deliberately perform what's called a fourth degree episiotomy. They would cut into the rectum of women while they were doing episiotomies because they wanted to, quote, practice how to perform a fourth degree repair because it's more complicated. And I was appalled at this. And I complained to our resident director, and then I was labeled as a troublemaker.
Of course.
So then I had to transfer from Brookdale to Harlem Hospital, where I finished the rest of my training. And I was very happy about that. So I just want to, throw that in there, that I have personally witnessed, the inappropriate abuse of Black women. So moving on to Mrs. Henrietta Lacks.
Thank you for that insight.
You're welcome. I'm gonna try not to cry. As I talk about her.
I'm with you.
Okay, so she, beautiful, physically beautiful woman, born in the same year as my mother, 1920, in Roanoke, Virginia, one of 10 children. And ironically, her mom died during childbirth. So during that time, when women had big families, and the mother, and it was, fairly common that women would die during childbirth, and really, not much has changed. So they would, relatives would take the children. So Miss Lacks ended up with her grandfather, and she was raised by her grandfather, and she had her first child at age 14. And the reason I bring that up, it's not a judgmental statement, but she ultimately died of cervical cancer.
Right.
And one of the risk factors for cervical cancer, and it disproportionately affects Black women, is the early introduction to sexual activity. So Mrs. Lacks was 31 years old, and she felt a knot in her, she felt a knot in the vaginal area. She went to her husband took her to Johns Hopkins because Hopkins was one of the few hospital institutions that would accept Black people back then. And most Black people in Baltimore were poor. And so it was an understanding that Hopkins had with the community that they would take care of the community. So unfortunately, Mrs. Lacks had a late stage cervical carcinoma. They gave her radiation, and it didn't work. And so part of the process was that they take cells from the cancer and they look at them, and they have this special department that does that. And so when cells are outside of the body, they no longer have the supply to survive, and they usually die. But then I'm going to try to be
this is real. Like we want to have real conversations. So
I'm going to try to keep it together.
I know.
In Mrs. Lack's case, her cells not only lived, but they doubled.
Wow.
And that was huge in terms of medical history.
Yeah.
And that was really the first example of the potential of a cell to be cloned.
Right.
So they kept it a secret, and they went on. She passed, after 8 months of treatment, and they kept her cells, they kept reproducing her cells and did all kinds of research, HIV research, vaccine research, because these are living cells.
Right.
And they were called the HeLa cells.
Yep.
And so they continue to do, like I said, all kinds of research. And
so I have a question. Do they have to get permission to, and they didn't, obviously.
So here's what happened. So they're rolling along, from 1951 to the 70s. And then something happens to the cells, or they need additional information. So now they have to go to the family because they need blood samples. So here it is, 20 years later, the poor woman, is deceased. And now they're knocking on the door of the family asking for blood.
Because they need something. Oh, man.
And of course, Black people's like, why you need my blood?
So what you doing? We know.
So then that opened up a whole door of controversy, because you get into
kick it open.
Informed consent. We never knew, et cetera, et cetera, et cetera. And, we have to give props to Rebecca Skloot. I believe that's how you pronounce her name, because she was a grad student and they were using the HeLa cells, and she was very curious about the origin of these cells. Where did these cells come from?
Right. Wow.
So long story short, once the family was informed, then of course, there had to be transparency and some sort of compensation for the descendants of Mrs. Lack. But it is amazing, the gift that she was given, the gift that we have all benefited from.
There you go.
Yeah, I mean, I could go on forever talking about the use of her cells, but
for everyone, not just Black women.
No, and that's the sad part, because the people who benefited the most were the people who didn't look like her or her family.
Right.
In terms of medical research. And like you said, medical research is like, it's an industry, millions and millions of dollars, probably billions right now of revenue that we can trace back to Mrs. Henrietta Lacks.
Yeah.
So the same kind of recognition that Mrs. Lacks eventually earned, we want that level of recognition for Lucy, Betsy, and Anacha. And there are hundreds of thousands of these unknown female heroes, who society has benefited from, who are basically anonymous and unknown.
So, and thank you for that. I mean, that's heavy and that's deep for me. I know a little bit about the story. I've learned some more, and it hurts. One, I'm a Black woman, right? and just knowing my own experiences. So even the story that you shared with your internship, I mean, I've had 3 daughters, and literally every single incident, you know, personally, like I always, like, you were a doctor,
Yes.
you were my doctor right next door, and I'm like, what is this? You know, the doctor's saying this, and this doesn't
Yeah.
sound right. I don't trust it, right?
Yeah.
And
Yeah.
you have been amazing in what you share, and throughout the years that I know all of the information that you have shared, and you are real. And I am interested to hear what you and your colleagues are doing to make sure that Betsy, Lucy, and Anarcha are being recognized, and hopefully if there's some path to compensation for families, or, you know, if I don't know if that's available, but I'd love to hear more about that.
Okay, so basically we started a petition to ACOG, and to ACOG's credit, I've been, like I said, a OB-GYN since 1987, and I've seen the transition in terms of more inclusion. We only represent 2%. Black women, Black OB-GYN, female OB-GYNs only represent 2%, and so we definitely have to increase those numbers. But ACOG has been more receptive. They are more receptive. You know, there was a time when you talked about racism and nobody wanted to talk about it. Like, oh no, you know, denial, denial, denial. Well, now they're open, they're receptive, and so we so far, and the number might be increased, but we have a petition of over 1,200 signatures where we are asking for support of the recognition of these women. So that's one thing that we're doing. We are also, and I have to talk a little bit about
let's go for it.
Medical apartheid. There's a book by Harriet Washington.
I have it. See, I know you, Dr. Gallo. Dr. Burke, I know you. I know you. I have this book right here.
That is a powerful, powerful, powerful book, because she really goes deep in terms of the experimentation of people of color. And of course, that includes women. And what's very deep about that book, and I haven't gotten all the way through it, but what's deep about that book is, and I don't, you know, like, what was the publication date on that? Do you know?
You continue, and I will look at right now.
What was interesting?
2006.
Okay, so what's interesting is the pushback that she received when she was writing that book.
Yep.
Pfizer, you know, you got to look hard at you know, big pharma, and that's why I'm glad I don't have any ties with them, because I can speak my truth. That's
right. Well, can speak about that too. There are a lot of physicians that are tied because they're getting money from these drug companies.
Yeah,
so they're not out here telling their truth, right?
Right.
So we're thankful for this.
So she wanted, the author wanted to, Pfizer, don't ask me how, but they ended up with this picture of Sims with with a Black slave, an enslaved young woman, and she wanted to use that picture on the cover of her book. And so Pfizer said, well, we have to read, you know, your manuscript. And she said, no, I'm not going to let you read my whole manuscript. I'll let you read a part of, like, one chapter. Right. And they read one chapter, and they said, no, we can't let you, you know, we're not going to allow you to use our picture.
Ain't that something?
You know, so that's where and this is Pfizer, okay, same Pfizer that just got $2 billion to do this vaccine for COVID-19, okay, same Pfizer. Then there was some other situation where I forget the institution, because she's a very impressive woman. She's done a lot of medical research, etc.
There's a lot of talks on YouTube. If you're interested, Harriet Washington is her name, everyone. So check out her YouTubes and all that stuff.
Right. So then she, somebody else heard about this book that she was writing, and they summoned her to their office, and she thought, it was just going to be a normal conversation, and they berated her, told her that her information is going to make African American women afraid and and distrustful. And so, of course, she checked them. She said, no, it's like the things that are going on that, causes a distrust. And this is one of the big issues in terms of the disparity in, for African American patients, because they don't trust the system. And I mean, can you blame them?
Right.
Can you blame them? She talks also in her book about the quote Mississippi appendectomy, and that was a euphemism for Black women being sterilized in the South without permission, without consent, and it was camouflaged as an appendectomy. And that actually, my aunt did not live in Mississippi, but that actually happened to my aunt.
Oh, wow.
She, they told her they were going to remove her appendix. And basically, after she had her, quote, appendectomy, she never had any more children. So these are all the things that go on that just contribute to medical errors, to the disparity. It just promotes the distrust of Black people because of the history of medicine. And so that is one of the things that we as as Black women, Black OB-GYNs, we are trying to encourage our patients to trust us. I mean, they come to us.
Right.
Sometimes there are not enough of us. So what we're trying to do is mobilize, start a data bank where people, okay, you're in Mississippi or you're in Chicago.
Yep.
You're looking for a Black female. Okay, here's our, we're working on an app. Here's our app. This is, and actually there is an app called.
There is some blackdoctors.org.
Yeah.
Well, they have blackdoctors.org and, but to talk about how you originally said there's 2% of all of you out there, it is hard in New York City alone. And my struggle. It was years trying to find a good Black woman OBGYN or GYN doctor, because it's not like you would think in New York there are a ton, but no, it's just because there's not enough, right? And we need more.
Right. And I also want to say this: we have to fight. You think as a patient, you have to fight. We have to fight. We have to fight to make sure that our colleagues, and we know it's not willful, but our colleagues misdiagnose us. They don't understand our culture. And so we're fighting, like a colleague, she's not a colleague, she's like my sister friend, the other day almost had, start a riot to get her patient C-section because the patient had preeclampsia, and people are just looking for laboratory evidence, and it's not a laboratory evidence. It's not a laboratory diagnosis. It's a clinical diagnosis. So, the struggle is real on all fronts.
Right.
All fronts. So we want our patients to know we hear you. We got you. We're fighting. We are fighting for you.
It's important. And it's important, right? It's important. It was important then. It's important now. And more so these stories that I'm hearing of these young, 23 years old, 24 years old, preeclampsia, right? Something that could have been diagnosed previously. And, you go in the hospital and then they do something that I'm all too familiar with. Oh, go home. You go home, and go home is like a death chamber if you are septic or if something's going on. And I've been sent home numerous times, and it's just like, no, I feel pain, and I was ignored. Right? From an emergency room level, it's just like, it's not that bad. You don't feel the pain. So how can you tell me that? And then you send me home and I almost give birth in my house with no medical equipment, no doula, no midwife, nothing. And I'm in fear because I was rejected from a hospital. Right. So, it's a lot of that needs to, I don't know the answer. And I'm thankful that you and your colleagues are doing something, but we need allies to help. And what I mean? It's so,
well, it's a movement that's going on, whether we want to admit it or not. It is a movement that's going on, because I'm very proud of the patients. They're woke, they're not sleeping. They're woke. They're asking questions. patients who were supposed to deliver at Woodhull, they're bailing, they're scrambling. They don't want to deliver at Woodhull, Woodhull. And that's like a whole nother story, because now all, like the OBs who they want to go to, they're now overwhelmed.
Right.
It's a spillover. It
Yep.
is something that we're going to fix, but we're going to need everybody's cooperation.
That's right. That's right. We have a question. So I don't want to pronounce this bill incorrectly, but what is your take on the Momnibus bill?
Yeah.
I mean, you know about it. Okay. So, it's put forth by Congresswoman Lauren Underwood and Alma Adams. What's your take on that?
Okay, yeah, so that is a very good bill. Basically, they want to extend, if I'm not mistaken, because there are a couple of bills floating around, but they want to extend what's called the fourth trimester and extend health insurance for 12 months after a woman has delivered a baby.
Oh, nice.
And the reason they want to do that is because, especially like with preeclampsia, a lot of times women will go home and they all have elevated blood pressures, and then they come back and they're misdiagnosed, or they don't have the health insurance to be properly followed once they have a baby. So that is a very important bill, and ACOG actually supports that bill. Yeah, that's good.
That's awesome. Do you have anything else that you want to add before we end and pivot? If there's any other questions, we would love to answer them, or Dr. Burke would love to answer them. Oh yes, there was a comment about the petition. I know right now it's a Google Doc that you all are getting together. So you all are working on putting it on a petition site so it can be shared, right?
Yeah. So what I want to do, once you do Google Doc and you sign it, then it disappears. So it's a technical thing. We're trying to get a link, and once we get the link, I'll have it on my website.
Okay.
And I'll tweet about it, and I'll talk to the other sisters who are, who are actively involved, and see how best we should get the link out so that we can get more support.
That's right. And your website is smartmothersguide.com. And on Twitter, it's right at the bottom. It's Dr. Linda OBGYN. She also shares so much information. I'm not pregnant, but this is such a good book.
Thank you.
Yeah. So
second edition is coming up. I'm working.
Yes, I'm excited about that. So we have a few minutes. Do you want to talk a little bit about the health disparities and pregnancy topics?
So what I want to, thank you for the platform. I think it's extremely important that women begin to understand how important it is for them to recognize their own risk factors. And one of the things that I'm going to do, I'm almost finished with, I'm doing two things. I'm developing a course geared for midwives and PAs to teach them how to diagnose the gray areas where most of the mistakes are made. And the other thing I'm going to offer are second opinions in terms of risk factors, because one of the two things that just break my heart, when we lose a mother and when we lose a baby, in terms of stillbirth. And so a lot of times these 66% of stillbirths are preventable. Okay, so what does that tell you? It tells you that there's definitely been a disconnect. So I want to offer a service where, I can look at your history and just point out risk factors that maybe someone else is missing. For example, if you're 16 years old, first baby, I'm going to look at preeclampsia until proven not. See, this is how people have to, the bottom line is when patients come, and this is what I'm going to teach, when patients come, you need to look at the patient and say, okay, I'm getting your history, but in the back of my head, I'm saying, okay, what could possibly go wrong? And I know that sounds scary, but it's not scary, because if I'm looking for a problem, okay, and it comes, I'm ready for it.
Right.
If I'm not looking for it, and this is what happens with my non-melanated colleagues, they don't look for it. They're stuck on one thing. And so then, preeclampsia has to practically smack you in the face, before you realize it's preeclampsia. So this is why I think it's important for patients to begin to understand, if you're a big girl, All right. You got a BMI of 40, that's a risk factor, boo. You know?
That's respectable. No, but it's true, right? Like, let's not ignore it, because ignoring these problems, and what I've learned from you, ignoring these body, any type of problems that could go wrong,
Right.
could end in a way that we don't want it to end.
Right. Exactly. So no, denial is not what we want to do when we're taking care of women, particularly women who have significant risk factors, which are African American and Latina women of color. So these are the things that I think are very, very important that women should be aware of.
Yeah. So thank you for that. So what I'm hearing you say is we need more on the Vote Run Lead side. We need more moms to run for office, right? Because we need right? Yes. So if you could give them a little bit of encouragement on that, if this whole half an hour didn't encourage them to even think that way, we need people to fight for us and fight for women.
Open up your mouth, okay? Like, I'm a quote the late Nipsey Hussle, and I wasn't a fan of his until he died, but he said, "A closed mouth don't get fed." Open up your mouth, okay? Because when you open up your mouth, people understand that, number one, you are strong enough to advocate for yourself, that you are aware of the conditions, and people will back up from you. They will start listening to you. They'll go beyond the color of your skin because you are making sense to them. See, that's how Serena saved herself, Serena Williams, because she was able to advocate. So I
love it.
Yeah.
I love it. Yeah. You got some thank yous. Erin Velarde, who's our CEO and founder, she said, "Thank you, Dr. Burke. This was really, really great. I love it.
You're welcome.
I want to amplify your voice as much as I can. So when you get the petition together, if we can, share it, send it an email, we'll get it out, because I know some people would like to look at that and support any way that they can.
Sure.
But thank you for all of this information.
You are so welcome. My pleasure, sweetie.
I ask you all to follow Dr. Burke. And another comment, thank you so much. I learned a lot today. And just, we have to all fight for each other, right? So we can all just, it's so much. And I'm just so glad, and I feel optimistic about women like you being in the center and doing this and opening your mouth and not, you've always been like that. I know, like, you will speak your mind in a minute. But thank you so much, everyone, and have a good evening. And Dr. Burke, I love you, and I'm wishing you all the success in the world. Thank you so much, everyone.
Okay, thank you. Bye-bye.
Bye. That was awesome, right? I love Dr. Burke. So here's the book again. Here's the other book. It's really good for, knowledge points. I've learned a lot from medical apartheid, and so I'm going to check out. Thank you for joining us at Vote Run Lead, and we have Your Kitchen Cabinet coming up next week on Wednesday. So make sure that you register, and we have links in our social. You can follow us, subscribe on YouTube, and leave your comments. If you have anything that you weren't able to share now and you want to share a little later with us, you can email us at info@voterunlead.org. Have a good night, everyone. Bye.